Good evening, everybody, and thank you so much for joining me tonight. I think that the live that we're going to be doing this evening is going to be incredibly useful and powerful for a huge number of people that tune in, and I strongly encourage you to get everybody that you know who is pregnant, postpartum, trying to get pregnant, or a support person for any of these people to join us tonight, because Nicole Highet is just a sort of a powerhouse in this area, and I'm very confident that she's going to be able to support and help so many of you through what has been an incredibly difficult time, and will probably continue to be a challenging time for a number of sort of weeks and months to come. Before we start, I just want to reassure all of my own patients at Francis Perry and the Royal Women's that there are no restrictions to how long a partner or support person can spend with you during your birth or the postnatal period, but it will be limited to your partner or one support person only. Antenatal visits are still only to be attended by the pregnant woman themselves, but certainly very happy to have partners FaceTimed or called in so that they can be able to participate in the consultation as well. Tonight I am absolutely thrilled to be joined by Nicole Highet, who is a renowned perinatal psychologist, who is the founder of COPE, the Centre of Perinatal Excellence. Nicole was also previously the Deputy CEO and Perinatal Advisor for Beyond Blue between 2001 and 2013. And I was planning on having her joining me at some point this year anyway, but thought given everything that's happening at the moment, I'd try to expedite her her chat with me, because I think it will just be so beneficial now. So I'm just going to get Nicole to join us. Hopefully we won't have too much trouble. She said she hasn't done this too many times before, so I'm hoping we'll get there soon. I think we've got to, give me 1 second. Excellent. How are you, Nicole? Well done.
The stress is over.
I remember the first time I did this, I was just terrified that I wouldn't be able to actually participate. So I had an emergency phone next to me from which I could call the person who I was doing the live with, just in case. But we're here, and thank you so much for agreeing to speak with me tonight.
An absolute pleasure. Thanks so much for the opportunity.
Oh, wonderful. Now, Nicole, obviously you will be sort of more aware of this than anyone else sort of I've spoken to recently, but clearly as an obstetrician, I have noticed that a huge number of my patients are expressing different types of stress, anxiety, depression, all different things in their pregnancy, in the newborn period, for women who I've seen pre-pregnancy who are trying to conceive. And I think that a lot of these terms are actually used quite loosely. Patients call and say, I'm feeling stressed, or I'm anxious, or I'm depressed. But I think it might be useful if we actually start our discussion tonight by you clarifying for everybody watching what these different terms actually mean, and how women or support people can actually work out what it is that they're going through so that they can find the right avenue for help.
Yeah, look, it's a really great question, and it's something that there is a lot of confusion about. And it's important to understand the difference between these different conditions or states, because it does impact on what strategies you might be able to use to help yourself, or when, it might be important to get help. So look, if we start at the very beginning, I think it's important to acknowledge that having a baby is already a time of great change. It's probably the time of the greatest change in your whole life, more so than any other time. You're going through physical changes as a woman, psychological changes. You're thinking about your future. What impact is this going to have on my future and my life and my relationships, not only with my partner, but my family and friends?
Yeah.
How's it going to impact with my work and my career and my identity as a person as I'm taking on this whole new role? So there is so many different changes going on at all different levels. Definitely. So it's no wonder that it's going to be a time where there is a lot of adjustment, and with that change goes feelings of often stress, and for some anxiety. So starting with stress is the most common condition that most of us experience. sometimes on a day-to-day level, depending on what your day's like, or a weekly level, where there's a stress. A stress is really defined as when something is forced upon you to try and you've got to draw on your resources to try and overcome or deal with that. So it might be something like a meeting you're not quite prepared for, or doing a speech in front of people and you're feeling. But once the stressful event or the deadline has been reached, those feelings of stress go away.
Right.
And so that's what stress is. So if you're in a really stressful job and you come home at the end of the day and, you can relax for the first time because the stress is over. And that's a little bit different from something like anxiety or depression. So anxiety is the next condition. Let's take a look at that. So anxiety is... it feels a lot like stress because there's things like, there's very physical symptoms associated with anxiety, things like a racing heart, palpitations, dilated pupils, worrying about things. And it's very, very common to experience anxiety at a big time of change, particularly if you're someone who has experienced anxiety in the past. So you're feeling these feelings on an ongoing basis, but they're not necessarily associated with a particular event or a stressful situation. They're just there all the time. And sometimes you're trying to understand yourself. Well, why do I feel this way? So you start to try and create a context to try and make sense of those feelings. So you might see things then as being more dangerous or more catastrophic than they really are. Right. So, and that almost keeps the anxiety feelings going because you're looking for a reason to legitimize the way that you're feeling. So it's very common with anxiety that people often have what we call, thinking things are more catastrophic than they really are. So in pregnancy, for example, you might have those feelings of anxiety. So you might put it down to maybe there's something wrong with the baby. Maybe something's not going to go right at the birth. Maybe... my friends aren't going to accept me when I've got a new child, or so you start looking for reasons to explain those feelings. So it's really important that we identify the feelings and look at our thinking and the way that we are thinking, because we need to challenge those sorts of thoughts. Well, why would my friends not whatever? Why would I, so we've got to challenge those thoughts and really rationalize them. And by doing that, we can come to a state of relaxing and being able to understand that thought that is giving all those feelings and sort of keeping them going is not really valid. And that's the only way you can really let go of that thought and dissipate the feelings on an ongoing basis. Because if you try and just distract yourself, it's likely that thought hasn't been processed and it will keep coming back. And that's why anxiety can be absolutely draining and exhausting. Because
debilitating.
So, and anxiety is very, very common in pregnancy. We know that up to 1 in 5 women will experience anxiety in pregnancy and 1 in 5 in the postnatal period. So it's really common, and it's really important that we identify it for what it is and identify the thoughts that we might be having which are contributing to those feelings, and really breaking it down. And at a time like this, with something like COVID going on, of course, that whole level is even more exacerbated because there's like this whole other thing that's happening, which is different and never happened to anyone else. And what do we know about it? So it's very easy to start worrying about that and getting into that anxious thinking. So we need to stop and really look at the evidence, get the facts, talk to our healthcare professionals, be guided by the advice, and take control. Because anxiety is so much about taking control.
Absolutely. Good. And in terms of depression, what sort of symptoms should people be looking out for there?
So depression is, it's a lot like anxiety, but different. It's a lot like anxiety in that you will again have reoccurring thoughts and feelings, and that affects the way you behave. But rather than being thoughts and feelings about something going wrong or something terrible going to happen, it's more of thoughts and feelings that things are terrible and life's not worth living, or things are just going to go badly. So always looking at the negative side, because depression, the feelings that go with depression are feeling really sad or down, loss of interest or pleasure, things you don't get enjoyment out of anything. And that, of course, can then affect the way you look at the world and you look at things that happen to you. So something neutral happening to you, like, for example, if you had a haircut and someone said, oh, you've had a haircut. So if you were feeling depressed, you'd probably think, she just criticised my hair.
Yeah.
She said something about the size of my growing belly. She's
Sure.
criticizing, she thinks I'm fat. So
Right.
you look at things in a very negative way. And of course,
Yeah.
when you do that, you're perpetuating and maintaining those negative thoughts, either
Yeah.
about yourself or your life.
Mm-hmm.
So again, you've got to nip it in the bud,
Yeah.
challenge those thoughts and say, well, is that really true? Did she really say that?
Yeah.
And really by doing that, you can rationalize it and let the depressing thoughts go. And that's what good therapy is about with treating these conditions.
Absolutely.
It's
Yeah.
about identifying and really taking control, because otherwise those thoughts can really take control of you.
Definitely. Now, I've had a huge number of questions from followers, which are quite specific to aspects of sort of the impact of COVID-19 in pregnancy. And I want to come to those a little bit later, but I thought we could start by keeping things a little bit more general to start with, because as you mentioned, a lot of people have had stress, anxiety and depression prior to COVID-19 sort of taking us all by storm. So for those people, I think it's important that we recognise that these are all issues which have been around for a long time and that we still need to address, regardless of the presence of a global pandemic. So
Yeah.
if someone were to, be experiencing stress, what can they do to look after themselves? I know you at COPE talk a lot about self-care. What sort of things therein do you find are useful for women who are pregnant or postpartum going through stress, anxiety and depression, and sort of what's your different treatment avenue for each of them?
Okay, so with stress, it's really, first of all, recognizing what is creating those feelings.
Mm-hmm.
Is it certain people? Is it certain interactions? Is it certain parts of your day?
Mm-hmm.
What are the things that are causing that stress, and what can you do to proactively take control or manage that stress?
Yep.
So some of those things might be, sometimes standing up to people, or, doing things like that. Or
Yep.
if you're finding stress at work really difficult because your boss has unrealistic demands,
Yep.
it's like, well, what can I do to manage that and take control of that stress?
Yes.
So looking at what is causing the stress is really the first thing. But then it's important to, of course, look at relaxation strategies. So things and different things work for different people. Some people find things like meditation very, very helpful. I can't close my eyes for more than 2 minutes before I'm wondering or thinking about something else. Different things work for different people.
Yep.
Sometimes just getting out back to nature, going for walks. Unfortunately, now we have to do it with a mask on.
Absolutely.
But just some, for me, just lying there and stroking my cat on the bed can make me live in the moment. It can just, give you that time out. But really, it's about recognizing what is causing stress and looking at, for a long-term solution, what you can actually do about that. Whereas something like anxiety and depression, so these can become at different levels. You can have mild, moderate, or more severe. So the most important thing is getting onto it earlier. The faster you get help, the faster you recover, and the greater range of treatment and options there are available to you. So with things like anxiety and depression, as we talked about, it's identifying those negative or anxious thinking, rationalizing those thoughts, doing things to take time out to help you relax physically. So for some people that might be exercise, and that can be exercise in the home. For other people it might be guided meditation, deep breathing, and we do have a whole section on the COPE website about tips for managing stress and relaxation exercises, but also they can be very helpful for anxiety. But
Absolutely.
once the anxiety or depression is starting to really take over your life, so you're finding it difficult to get through the day, you might start avoiding situations because you just think, I can't get through that, because of anxiety, or you're avoiding situations because like from depression, because you just don't have the energy. Once it starts to impact on your ability to function from day to day, that's when we say it's becoming a disorder or a condition that needs treatment in its own right. Just like gestational diabetes needs treatment, so do these conditions need treatment.
Definitely.
And there's a range of different types of treatments. So there's psychological treatments, like what we call cognitive behavior therapy, which is all about really targeting those thoughts, the behaviors and the feelings, and learning how to take control. And there's some really good online treatments actually specifically for expectant and new mums. Like there's Mum to Be Mood Booster. We can do an online course to teach you strategies around managing those types of thoughts. And then there's obviously psychological treatment you can have through a therapist, or there's a range of practitioners who provide that. But sometimes the conditions can be so severe that it can actually impact on your thinking, the way you think, and your ability to actually rationalize those thoughts and feelings. And so in those cases, some medications might be required.
Absolutely.
As a first-line treatment, and then often after that, you can start getting the benefits, and then you can engage in the other therapies. There are a range of other psychological therapies as well. Probably 3 or 4 others, but really the national guidelines recommends the cognitive behaviour therapy as a first-line treatment. And certainly there are other treatments, and it's to some degree different types of treatments will suit different people, but they're the most provenly effective treatments.
Definitely. It's interesting when you talk about medications, because I think I'm certainly seeing an increasing number of women on antidepressants or anxiety medications throughout their pregnancies. And a lot of them are quite reluctant to take these medications. I think they've read about them, and they've read that there are potential side effects for the newborn or for the fetus. But I think what we often see is that the risks of not being on a medication far outweigh the benefits. And for a lot of patients, it's so important that they stay on their medications in conjunction with having appropriate psychotherapy during a pregnancy, because being in a good emotional and mental place to look after a newborn is so critical. And I think it's a discussion that they need to have with their psychologist, their obstetrician, and their care providers, because just stopping medication as a rule is certainly something that shouldn't be done. And I think that it's really important that it's individualised for every woman, and that they seek the care they need before they just stop medications because of things they've read. Would you agree with that statement?
Absolutely. And, the national guidelines has actually reviewed all the safety and effectiveness of medications and their safety during pregnancy and breastfeeding. And there's a class of medications called SSRIs. And they are indicated to be safe and effective to be used in pregnancy and when breastfeeding. So
absolutely. I endorse that completely. Fantastic. So what we might do is go into a few specific scenarios or questions that have been put to me that I think you will be brilliantly able to answer for all of us tonight. So we've spoken about stress as being something where you have something that, in that moment is stressful for you, but then as it passes, your feelings go with that. COVID-19 poses a real challenge therein, because it's not something that is going away today or tomorrow or later in the week. And I think a lot of people are finding it difficult to say, this is something that's transient. They're looking at it as a long-term thing that's going to be with us, and that's really worrying them. So what strategies might you be able to give to people watching this evening who think, well, what can I actually do to help myself overcome the distress or stress that this is causing me, so that it doesn't turn into clinical anxiety?
Yeah, look, it's a great question. And I think this is where considering the broader context that we're in right now is really important. It's always almost part of the cognitive side of therapy here. So the first thing to recognise is I know when things like the restrictions are coming in, and now we're asked in Victoria that we have to wear masks, and we can look at that as a more scary thing. And is this getting out of control, and how will this affect me? And again, we can get into that thinking that, this is going to take over. But we need to look at this and balance this with the evidence and the reality. So number one, Australia is a very preventative focused country, and we are very effective, and we will always take a prevention, early intervention approach. You only have to compare America with the United States or the UK to see we are far more conservative and avoid risk-taking. And so part of the reasons we do have these restrictions is about protecting us. And we're doing that as more protection. Although it might feel like things are out of control out there, for you, where you are at the moment, there is so many controls being put in place to manage this. And that's what we need to focus on, rather than focus on what we can't control or what is going on, and making sure we're not getting our reactions to stress aren't things that are out there that we can never control. If we're reacting to those things, and sometimes things like watching too much news and media, we can start to feed into that. But at the end of the day, that's happening out there. It's not necessarily what's happening here. And you do have a certain level of control And you can manage a lot of things about the position that you're in, and we are taking a very safe approach. So I think it's always about bringing it back and, again, testing the evidence, challenging the concept, and making sure that you're not putting additional worry, apprehension and stress on yourself by looking at the big picture, and which is beyond anyone's control, even a president or prime minister.
Absolutely.
But we can manage ourselves, and we've got to focus on what we can control and what we can manage.
Definitely. And I think you're absolutely right. Within the hospital system, there are so many extra precautions that are being sort of put in place to keep everybody safe. You know, there's such thorough screening when anyone enters the hospital, both for patients and their support people. You know, within each of the rooms, there are lots of, you know, things put in place to ensure that social distancing is adhered to. Everybody's wearing masks. There are screens up. There's, you know, strict hand hygiene with hand sanitizer everywhere. There's a lot that's being done within the healthcare system, I think, to keep people safe when they come in for their visits. And I think you're right, being reassured by knowing that all of that is being done for your protection is something which will help to alleviate that stress somewhat.
And even the smallest things, Scott, like instead of someone with PPE and going, oh my God, look how masked up they are, whatever, that's there to protect me.
Yeah, great.
And make contact with the person's eyes, because that's the human that's there, and they're there to care for you. And focus on what you can, and look at those things as being there to protect you. Look at that, the positive and the bigger context here, rather than being freaked out by that.
That's a great suggestion, because I've certainly got a number of patients that are really quite terrified of getting COVID-19 themselves, what that means for them as a pregnant woman, and equally for their fetus or their newborn. And I think focusing on the positives is important, because you're right, we can't just get rid of COVID-19 overnight, but we can try and look at it in a way that we are doing well here overall, and that, you know, when they come into the hospital to be cared for, everything's being done to keep them as safe as possible.
Yeah, and I think the other point there is, Scott, that we've actually put a whole section on our website if people want to look at cope.org.au and even search for COVID. You'll see we've actually gone through there and explained, well, what would happen if I got COVID? What is the likelihood? What if I did get COVID when pregnant? What would be the impact on me? What would be the impact on my baby? Is it safe to breastfeed with COVID? And it's all actually very reassuring.
It is.
So again, getting the evidence, getting the facts based on the evidence and the research, it's actually quite reassuring and can really help with alleviating anxiety, because if we don't look at those facts and we're looking at the big media, it can catastrophize the situation and lead to more stress and anxiety as well.
Definitely, I agree with that. And as you say, what we know about COVID-19 and pregnancy at the moment is that pregnant women are not more susceptible to getting the infection. They're not more likely to become unwell if they do get it. There probably is some vertical transmission, but there's no increase in the risk of miscarriage or congenital abnormality or sort of growth restriction as far as we know. So you're absolutely, you know, sort of on board with what I'm telling my patients. And I think it's great that there's so much consistency, which is really, really good. But no, I'm completely in agreement. Yeah, definitely. Now, the next thing that I've been asked about a lot, and this is, I think, sort of what has been stressing patients out the most over the past week, with announcements about changes to visitor restrictions, are sort of those days after birth. And I know there's a section on the COPE website, which is brilliant. I've read it myself about the days after birth. You've got women who are just exhausted. Their hormones are all changing. They're having challenges feeding. What's your advice to women in those few days after birth in general, but also in the context of, at the moment, of not having the same physical support around? You know, people's parents and relatives and friends aren't allowed to just pop by and sit down and, you know, take over for a couple of hours while you have a rest. There is some sort of leniency with carers, and we are certainly providing, you know, certificates where needed to say that some people do need an extra bit of care after a cesarean section, for example. But in general, in those days after birth, what can couples do to sort of ensure that they're looking after themselves as best as possible, and particularly in view of the changes that have been sort of implemented recently?
Yes, look, I think part of the part of this anxiety and everything that's going on here is because it's not what you expected.
Yeah.
And I think it's really important when we talk about pregnancy and becoming a parent is to always be aware of our expectations.
Yeah.
I'm sure people who are pregnant now and maybe expecting their baby soon have maybe experienced things they never expected to in the first place. I think, you know, we all expect when we're ready to get pregnant, we're going to get pregnant, because we spend so much time making sure we don't get pregnant.
Correct.
We expect that pregnancy is going to be glowing and everything's going to be great, and that might be far from the experience of some. There's lots of, you know, we've got to check in with our expectations all the time, and that also applies to the birth itself. Being realistic about your expectations of birth. I'm always very cautious about elaborate birth plans, because sometimes the most anxious personalities or people who are more anxious are likely to have more detailed, specific birth plans, because that gives them a greater sense of control going into the birth. But in fact, then if things don't go to plan, which is usually beyond your control, it's going to increase your level of stress, because my mat it's not going the way it's meant to, which creates its own level of stress on top of what's actually happening. But it also can lead to feelings of failure after the birth, because it didn't go as you expected, or that you're putting demands on yourself. So it's really important to be aware of your expectations before going into birth. And part of the recovery process is also taking that time to reflect on what might or might not have gone to plan. But whatever happens, during that time, it's really important that you remind yourself it is never your fault, whatever happens. And taking that opportunity to be with your partner for the time that you can, straight after the birth, to just recenter. And, you know, it's about conserving, getting your energy back, getting yourself back, and just taking that time to recover. And in some ways, dare I say, not having visitors can actually be a really positive thing, because it does put this other level of pressure that you've got to, you know, everything's got to be right for everyone. Everyone wants to see the beautiful baby. Everyone wants to see that you're bouncing back and everything's going great. It actually just gives them more space to take time to recover.
Definitely.
So in some ways, try and focus on that as a really positive thing in this context. And because I think there's a lot of benefits here. In fact, I've read some research suggesting that with lockdown, there's actually been much better rates of things like breastfeeding, because people are having more of that time to really just recenter and have that time without the busyness of everything else. So there can be a lot of benefits to lockdown.
Absolutely. You've taken the words out of my mouth, actually. The midwives, Francis Perry, where I work, have said that the sort of the way parents are managing to bond with their newborn, to establish feeding, is much more positive than they've seen ever before. And they're all actually loving not having so many visitors around, because it's meaning that new mothers and parents are just really flourishing, in their words. So I think that it's important, as you say, to look at what can actually be gained from having fewer visitors around. And there's still FaceTime and all that sort of stuff, which is wonderful. But I still think there are, you know, apart from the physical concerns, a lot of people that are sort of anxious about missed experiences, you know, the experience of having the grandparents walk into the postnatal room, the experience of having proper in-person birth classes, the experience of having your baby shower or your gender reveal. And for people that are sort of feeling down or sad or upset about all of that, what can they do to help those emotions a little bit?
Well, I think it's important to acknowledge, you know, that you might not have had the birth experience that you wanted with the visitors there, or the baby shower, or indeed the mothers groups when that comes to as well. And it's important to acknowledge that, I think, and there's no point pretending that it's not happening or brushing it under the carpet. But I do think it's important to look at what's really important here, and that is your beautiful, healthy baby that you have. It's what you do have in this situation, and that we are living in a time where these things are there to protect us. And how can I make the most of this situation? How can I use this opportunity to really bond with my baby without other distractions or pressures? There are pros and there are cons, and I think we need to acknowledge that. But look at what we can do about emphasising and maximising the pros to make the best that it possibly can be for us. And we also have to be, I think, a little bit innovative. I mean, thank goodness we're going through this in a time where we do have social media. We can still FaceTime. It's never going to be the same as the face-to-face contact or holding the grandparents holding their baby, and it is for the safety. But we still do have that contact, and we can still see and have that contact with people. Whereas, you know, years ago in other pandemics or major world events, we wouldn't have had anything like this. So again, how can we maximise that to the best of our ability and look at the pros? Like, you know, if someone does FaceTime and you're absolutely exhausted, it's much better that you can not take the call and say you're in the shower than have to have visitors come into the room and you're having to hold it together, which is going to build up your tiredness and your the way you're going to feel down the track.
For sure, definitely. And sort of looking at the other side of it. So we've said, you know, a lot of, I think, pregnant women are upset about not being able to share the experience with their loved ones. Equally, there are a lot of loved ones who are very upset about not being able to share in the experience. And I know that was certainly a great fear of a lot of partners over the last week when the initial sort of statement came out saying that partners will only be allowed to be there for 2 hours a day on the postnatal ward, which has since been sort of rescinded in hospitals at which I work. But for partners or support people who are grandparents for the first time, who are really upset about not being able to be there in person and feeling quite down about that, how can they manage those sorts of feelings? In addition to physically, you know, making the phone calls and all of that, what else do you recommend that they do to sort of help themselves feel more positive about the situation?
Look, I think it's about keeping them as involved as you can do in the situation. So, you know, letting them in about how the baby's going and how you're going, letting them see the baby and being as involved as they can be. That's at least, the grandparents will want to see that the baby's well and that you're well. I mean, at the end of the day, that's what they're going to be focused on. Of course, they won't wait to hold the baby themselves, but in the meantime, they can really, they want to know that everything's okay, and that's the most reassuring thing that you can do, and just revalidating it and getting the support you can give to each other in these circumstances.
Definitely. And while we're sort of on the subject of partners or support people, we've spoken about, you know, the high incidence of sort of perinatal anxiety and depression. What about in partners? Is it something that you see commonly? Is it something that we sort of just don't talk about enough, but is actually more prevalent than we all realise?
Absolutely, it is, Scott. So we know that up to, well, there's varying statistics that sort of fly around, but, you know, that many will say that up to 1 in 10 men can experience anxiety and depression. So it's not as common as women, but it is still very common. When you think about how many of your patients that their partners will be affected.
Huge.
Also, the father is 50% more likely to develop anxiety and depression if the woman has depression or anxiety herself. So these are conditions that are very debilitating for the individual, let alone having the additional pressure of looking after a new baby. But particularly for men, I think there's a number of other barriers as well, and that's that the men feel like they've got to hold it together, they've got to be the provider, they've got to be the strong one. So often they don't acknowledge the way that they are feeling and trying to hold everything together. In addition, there's often additional stigma for depression and mental health conditions in men. I think that's got a lot better over the years.
I think so too.
But I think there's that pressure that fathers still feel that they need to be holding the family unit and being the strong one to keep everything together. And that ultimately, often they might do it for a period of time, but in the longer term, you know, it's again getting the help earlier is more likely to give them strategies and things to cope, and let the couple work through it together. But by not talking about it or hoping that it's going to go away on its own, or just putting it down to being a new father and thinking I've just got to take it on board to, you know, try and manage and hold everything together, it's likely to lead to more negative consequences than actually being proactive. And that's why the government's very keen that actually fathers are also offered routine screening for anxiety and depression, just like women are out in the next 12 months or so.
Brilliant. Fantastic. So sort of touching on, you know, a bit of postnatal depression now, because I think it's just so prevalent. A lot of people are probably aware of baby blues. You know, it's spoken about all the time. I had the blues after my baby was born. When do the baby blues become something more? When should, women and their partners be aware of it? When should we as obstetricians start to worry about our patients? When should GPs who are seeing their, patients a few weeks down the track be concerned? When do the blues become clinical postnatal depression?
Mm. So typically the baby blues is really related to changes in hormones following the birth, and it usually, so they sort of come and go on their own between 4 to 6 days after birth. So it's usually in the first week or two it usually has subsided on its own. It just really needs understanding and support, and of course having some understanding about what this is and monitoring it. But it's very common that people, so technically if a woman was really struggling with symptoms of depression, technically it would be from 1 month postpartum, so 1 month after you've had your baby. Any time from that time through the first 12 months would be categorised as, so to be classified as depression, you have to experience a number of symptoms, different types of symptoms over a period of time. So the most key ones are things like feeling sad or down, loss of interest or pleasure in life. And in addition to that, you would have things like changes in sleep, that might be wanting to sleep all the time or not being able to sleep at all, changes in appetite, which can lead to major weight gain or weight loss, not interested in any activities, don't get pleasure out of things that you used to get pleasure out of, just no interest. So if you're experiencing those sort of range of symptoms over a period of 2 weeks or more, anytime from the first month, that is likely to be an indication of postnatal depression. So technically, it's classified as postnatal depression up till the first 12 months after you've had a baby. But the truth is, often it occurs a lot earlier or can occur later. It doesn't make it any different to treat that it's postnatal depression or depression at another time of life. It's not actually a different condition. It's just that the likelihood of developing it is much greater at this time of life because of all the other demands. And if you think the demands of getting through the day with depression aren't hard enough, when you have to put the needs of a baby first to look after a baby, that's why it can be so debilitated and really escalate and become more severe. So this is why we really need to have an understanding about how it differs from the blues. And quite often we know that people think it's just the blues. Even 2 months after, they're feeling, they're struggling. Oh, it's just the blues. It'll go away on its own. And it won't go away on its own once it becomes moderate to severe. So it's very important that we identify it and get treatment. And as I mentioned earlier, the faster you get help, the faster you recover. But unfortunately, from our research, around 74% of women who got postnatal depression or anxiety or during pregnancy did not get help until they reached that point.
Really?
So they got to the point that they couldn't cope before they got help. So
Terrible.
that would be like with gestational diabetes, waiting until you'd passed out and couldn't move. In a diabetic coma before you got help. You'd never do that.
Absolutely
not. The same needs to apply to mental health conditions like anxiety, depression,
yeah.
so that you can get on top of it quicker and give you the skills to manage it and nip it in the bud before it starts taking over.
Excellent. So what is the right avenue for people to pursue then when they're worried about this? You know, if they're 3 or 4 or 6 months postpartum, they're probably not in touch with their obstetrician anymore. You know, your postnatal check's done at 6 weeks. Who should they seek first in order to make sure that they're getting the help they need? Is it the GP? Can people access a psychologist directly? What is the right avenue for people to go down in order to make sure that they're getting the help that they need?
Yeah, so the first protocol we would say would be your GP.
Yeah.
And look, some GPs, just like some GPs, are very good at treating some conditions. They might not or may not be as good with mental health conditions.
Absolutely.
So if you're not happy with your GP, don't think twice about going and getting another opinion from another GP.
Yeah.
A GP can then diagnose. He'll ask you a number of questions and how you've been feeling over a period of time and the different symptoms. And he can then diagnose whether you might have postnatal depression or depression during pregnancy. Remember, 1 in up to 1 in 10 will have it in pregnancy.
Yep.
And then they can do what we call a mental health care plan. And that can involve then referring you to a psychologist, a mental health social worker, or a mentally health trained person who can then provide that specialised treatment. They may or may not decide to provide medication, prescribe medication, depending on the severity and your particular status. But remembering the psychological treatments are very, very effective and also very helpful to helping you gain the strategies to take control of the condition over time. In fact, I did my doctorate on that topic, comparing people who just had medication with medication and psychological treatments. And whilst they got better at about the same rate, people who had the psychological treatments were less likely to have to require to stay on medication over the longer time, because they're developing those strategies to take control. So certainly GP would be my first port of call. Get your mental health care plan and then get a referral. And COPE is actually developing a national directory of perinatal mental health specialists, people who really get this area and understand this area, and we'll be able to help you find a specialist in your area. And one great thing about COVID is it's led to us all being able to get these treatments under Medicare via telehealth. So again, that is a benefit, and something that people are really taking up. It's a great opportunity.
It's so good. It's so good to have that centralised sort of service at the moment. I recommend, and I sort of talk to a lot of my patients about the antenatal and postnatal psychology network, because that is a good way of accessing perinatal psychologists specifically. But, you know, I'm certainly very much looking forward to COPE having something that we can access, because as healthcare providers, it's very useful for us as well to know who specifically we should be directing our patients to. So I think that's really, really wonderful. Excellent.
And I'd also always recommend the Panda helpline as well as a port of call. So there you can talk with a trained health professional. Again, they specialise in the perinatal area, and they'll be able to help with doing an assessment and helping you, you know, identify and providing you with that support that you might need at the time. It might take a time to get into a service. They can provide that ongoing support for you. So Panda is also somewhere what I'd really recommend as to have it on your list as well, as an organisation to reach out to.
Excellent. And Nicole, what do you see as the role of a mother-baby unit in women who are really struggling, you know, feeling really down post-birth? They're struggling to sort of get on top of those blues or that depression subsequently. When is a mother-baby unit helpful? Is it something that you would use in this context, or is it not something that, you know, you would use for women who are suffering from sort of severe postnatal depression?
Yeah, so a mother-baby unit is really a consideration usually in relation to very severe mental illnesses, and that might include very severe postnatal depression and or anxiety. Interesting to know is that around 50% of people who have anxiety also have depression at the same time. It's very common for these to co-occur. But once they get to the point that your safety is a concern, so worrying about that you're going to be a risk to yourself or not be able to look after or care for your baby, and need that supervision and support, or you might be trialling a particular medication and really require that supervision, medical and clinical supervision, often from an expert, a specialist mental health expert like a psychiatrist, then mother and baby units would generally be the port of call. One great thing about living in Victoria, if you do ever find yourself in this position, is we have more mother and baby units than any other state in Australia.
Right.
So at a time when Victoria might not seem like the best place to be, if this happens to you, it actually is, because we do have a wide number of both public and private mother and baby units. So that care and support is there. So it's really at the stage when there is concern that you're really not able to function, or you might be at risk of harming yourself or others.
And I've had some women wondering if they can self-refer to a mother-baby unit. Is that possible, or does it always have to come via a health professional?
Look, it depends. I would say generally it would be by a health professional. Often the beds are in demand, so like a retreat. So generally it would generally require a referral from often a specialist psychiatrist or a health professional, and generally would have to go through a process. But again, it might be slightly different in the private sector, and depending on the availability of beds. But yeah, it's really about what's available, and and what your health needs are and mental health needs are at the time.
Absolutely great. If you've got the time. I think a
Yeah.
lot of people at the moment have been planning pregnancies, some for a very long time, and COVID has sort of made them wonder if now is the right time to get pregnant. Now, based on all the pregnancy data that we've had, I feel very reassured, and I've said to women and couples who come to see me that I think now is a completely fine time to get pregnant on the provision that they don't have any underlying medical conditions like cardiac or respiratory disease, which might make them more susceptible to a severe infection if they were to get it. But for couples planning a pregnancy at the moment, I think they're a little bit more anxious than previously, given everything that's going on. And I think that there's a lot that can be done to prepare yourself psychologically before you get pregnant at any time, but now more so than ever before. So for couples that are thinking about getting pregnant or who are in the process of trying to conceive at the moment, what is your advice to them about optimizing their mental and emotional well-being before they embark upon what you've described as, a really significant 9 months and thereafter in their lives?
Yeah, look, it's a great question. I think in relation to the whole, shall we wait and hope this passes, or, we've all got to get on with our lives, and we might be in a position where we have to live with COVID and we can't put life off. We've got to move forward.
Agreed.
And we've got to move forward with our own lives.
Yep.
So in terms of preparing for pregnancy, I think it's really important to be very aware of your expectations about becoming a parent, why you want to have children, whether you and your partner both are expecting the same, having those conversations about how you both see yourselves as parents. It's one thing when you go from being two single people to coming into a relationship, but then when you're going to become parents and someone else's needs are going to become first, how's that going to impact, and how are you going to manage that, and what are your expectations and the reasons why you both want to have children? I think that's a really good, important conversation to have. And just being also realistic about, what impact do you think a baby's going to have on your life? It's going to lead to people having to make sacrifices. It's going to lead to changes in priorities. It's going to lead to changes in your relationships, not only your own relationship, but also your relationships with your families and friends, because your priorities are going to change as individuals and as a couple. So I think it's about being very mindful of that. I did see a quick, someone bringing up a comment earlier about what if the partner is resentful towards the baby? I think that's a really interesting, a great question, because sometimes, going to relationships, it can often be, a relationship before a baby comes along. You've got to look at that relationship. What is making that relationship work? Is it about, sometimes when partners might find that they are not as excited about the baby or might be resenting the baby, it might be because they are having the baby's needs for the woman is coming first before them, and they might be resenting that. So this is where we need to prepare early and have these conversations about this is our baby and these are going to be the changes, and we need to understand that that's part of bringing a new vulnerable baby into the world, and it's going to impact on, we've all only got so much energy and so much attention that we can direct. We can't keep giving our husband or partner 100% and also giving 100% to the baby. It's just not mathematically possible. So we have to be realistic and have those conversations and look at the dynamics, I think, in our own relationships, as well as our expectations and acceptance about what might change and what you're happy to give up before having children, and just hoping that the baby's going to come along and everyone's going to fall in love with the baby and it's going to be perfect. While that does happen for many couples, for some it doesn't. So I think being mindful of the dynamics of your relationship before you start, and how it might change and what you're both prepared for, and being aware and mindful of these things and how it might impact on your relationship with your partner. It's very important.
Absolutely. And for women with underlying anxiety or depression prior to pregnancy, is there sort of level of wellness that they should be at before they embark upon trying to conceive? Do you find that women with very well-controlled anxiety and depression are much less likely to relapse than those that go into pregnancy with sort of less well-controlled sort of anxiety or depression?
Yeah, look, I think it's, we certainly know that if you have an pre-existing history of anxiety or depression, your likelihood is much greater of having a relapse. But again, if we're aware of, this is where it's actually really helpful, if you've had a previous history, to be able to look back on your previous times that you might have experienced anxiety or depression, and look what were the warning signs, what were the first things that I experienced. What did that look like? What did that feel like? And I think being proactive about reflecting on that can actually give you insight in that someone who might have it for the first time during pregnancy would have no idea about what this is. But you can actually draw on that previous experience, because then if you're finding yourself that this is actually familiar, I think I've felt like this before, it can help you nip it in the bud and getting on top of it sooner. And you probably also have some good knowledge and understanding about what worked for you before in terms of treatment. It might have been a particular type of treatment. It might have been a particular health professional. And going back and just refreshing that and to get on top of it, it's a great advantage. So certainly I think you want to go ideally into if you're trying to become pregnant, feeling in a good place, but see it as actually an advantage if you've been through this before, because you've probably got more insight into what's worked and how you've built those skills to get over it before. So use that and draw on that knowledge and expertise this time, to identify the signs early and get on top of it using the skills and the insights that you got from the last time.
Brilliant. Well, there are so many other things I want to talk to you about at some point, but I might have to invite you back for a second live, because we haven't even touched on, the psychology of infertility, pregnancy loss, and all of those things, which I think are just so critically important, that I would love the opportunity to chat with you about those in a similar forum in the very near future. But given our time sort of limitation tonight, we'll probably wrap it up there. Before we finish, I'd love you to just tell everyone a little bit more about what COPE is, how they can access its services. I certainly know it's got a brilliant Instagram page, which I look at all the time myself, and I've looked at the website, which I think is wonderful. But just for everyone watching tonight, what are the best ways that COPE can help them?
Yeah, so COPE is a not-for-profit organisation, and our website is cope.org.au, and all the topics we've covered tonight and so much more is on the website, about all the things about expectations, all the things that can come up during pregnancy, birth, and the postnatal period, and even when trying to have a baby, that often people are not talking about and are not spoken about openly. So the COPE website is a great go-to place at any time for any of these different types of topics. I'd also really encourage you to look at we have this Ready to Cope guide. So this is a free fortnightly or free weekly email that you can sign up to, indicate how many weeks pregnant or postnatal you are, strategies, insights to help you cope, that's timely and relevant to where you are in your perinatal journey. So you can just sign up at readytocope.org.au. There's one available for mums and one for expectant and new dads, and we give dad some good tips and strategies how to look after himself and also you and the baby. So it's a really great resource, and particularly in times like this, I'd also encourage mums and dads to look at online support networks like Mama Tribe. So mamatribe.com is a great online community. So we work very closely with Mama Tribe. It's now become incorporated into COPE, and it's very much about creating a caring community. And at times like this where we don't get to go to mothers groups, Mama Tribe can be a great resource. And there's a similar version for fathers called Dad's Group. So it's a great network that you can join, and in the future you'll be able to have face-to-face meetups and connect with other dads too, because this can be a very isolating time. So that will you can connect with other people in the same position.
Brilliant. Excellent, Nicole. Well, I think I certainly feel very privileged to have the opportunity to chat with you tonight. And I think that everyone who has tuned in has found it incredibly beneficial, and it will certainly be saved on my Instagram page for people to watch whenever they choose to. And I'll be sharing this with all of my patients as well, because I think it's such an important topic to talk about. But thank you so much for your time. And as I said, I'm very much hoping that we'll be able to do it again soon to continue this very, very important discussion. But thank you so much much once again. I hope you keep safe and well, and thanks for all the really wonderful work you do to look after families everywhere.
Thanks so much for the opportunity, Scott, and to all you wonderful mums and dads to be out there, wishing you all the very best.
Thanks so much, Nicole. Take care. Bye-bye.
Take care. Thank you.
Bye.
Bye.